How common do you think this is? Highly distressed couples who show up for therapy. Each partner declares they want better communication and a better relationship. They take the time, the trouble, they spend the energy, the money to see you and embark on this process. What could possibly go wrong? What goes wrong often lies in one key area. It's motivation, or better put, a lack of or very low motivation. And I see this in therapists' offices worldwide. So just what is motivation? It's an urge or an inspiration that moves or prompts a person to take action. Low motivation to comply with a partner's wishes is common in highly distressed couples because frequently one partner desperately wants a change that the other just has no urge to do. Common examples are disagreements about chores, parenting, sex, and money. Even when the unmotivated spouse agrees to make changes, they soon lose focus, make impulsive decisions, undermine progress, or retreat into their emotionally self-protective bubble. Then comes blame, guilt, shame, and criticism to motivate change. However, trying to motivate through coercion just doesn't work. Sadly, it's the most distressed, traumatized couples that use guilt, blame, and shame the most. And the outcome is even more stubborn resistance from the partner. Deep down, the blamer knows that what they're doing is ineffective at best and caustic at worst. Yet they can't seem to stop themselves. You want to facilitate the process of how they connect and collaborate. You interpret, you redefine, you slow things down, and you work to help them be more open and more respectful. But they stubbornly resist your enlightened attempts to manage their interactions. You can end up feeling awkward, uncomfortable, even unprofessional, because they are paying you to do something more than watching them repeat the same painful struggles over and over. My name is Ellyn Bader, and this is the first in a series of videos that I'll be sending you about motivation. And just why am I interested in motivation? Well, as a child and a young adult, I tried really hard to motivate my mother. Her self-esteem was low, and she would never take risks to realize her talents. She wanted to be a poet or a writer, but sadly all her work was locked away in boxes in our garage. I encouraged her, and she always had excuses why her work wasn't good enough for anyone to see. One of my earliest decisions that I frequently said to myself is, when I grow up, I am not going to be like you. But I was always curious about what it takes to get someone to be enthusiastic and committed to taking action. There's another reason too. I've been training therapists on 6 continents for the past 28 years. I can't count the number of times I've seen well-educated therapists get stumped by entrenched hostility or ingrained passivity. Sadly, couples don't understand why they're struggling. Often they think there's something wrong with their partner or something's inherently flawed about their relationship, rather than consider that they are on the cutting edge of their own development and their own growth. However, inspiring change isn't simple or easy in couples work. The most enduring characteristics in unmotivated partners are helplessness, hopelessness, and defensiveness. And it's human nature to seek safety when feeling fear and pain. The emotional bubble is where unmotivated partners hide out, where they seek safety. When each partner is in that bubble, they feel overloaded by fear, pain, and resentment. So just how do you ignite motivation in estranged partners and lead them out of their desperation? The journey out of the bubble means risking transparency, opening to vulnerability, choosing healthy assertion, and initiating emotional connection. This is not easy for any of us, but it's especially not easy when fear predominates. All of these are terrifying, while they are so self-protective inside that bubble. Living in the bubble also makes it very easy to ignore a universal law, that actions have consequences. The more entrenched each partner is in their own bubble, the less they are able to appreciate the impact they have on each other. Each partner minimizes, denies or rationalizes how they activate the problem and how much of a role they play in driving their partner farther and farther away. Sometimes you hold a bigger vision of what's possible than they do. Sometimes their fear, resentment, and pain are greater than your skills to shed light on the pathway out of their bubble into sustained self-improvement. What all this means is that sometimes you have little leverage to ignite that inner spark, to incite the desire to take action, until now. Stay tuned, because in just a few days, I'm going to send you another short video where I will take a deeper look at how to view this problem from the perspective of the couple's developmental model. I'll describe the couple's motivation equation that has 4 components. Interestingly, desire is only one element of motivation, and as you learn the 4 components of motivation, you can use them to pinpoint exactly where you will get the best results from your efforts. It also will help your clients see more clearly why their patterns are not changing. However, before I send you my next video, I'd really appreciate getting your reactions and your comments. I'd love to know, do you see couples where lack of motivation is an issue? On what topics is motivation often the lowest? Please share your comments below. Until then, I'm Ellyn Bader, and I do want you to know that when it comes to working with couples, you are not alone.